Live from SABC headquarters in Auckland Park, Johannesburg. Welcome to this evening's episode of The Watchdog. My name is Vuyo Mvogo. In news just in, we now have 8,581 cases reported in South Africa over the past 24 hours. Yesterday, this time, we had 4,373 cases, which means the numbers have more than doubled over the past 24 hours. We hope to get to the bottom of those numbers during the course of the program. WhatsApp messages that could send you to jail. We look at the implications for you of a new law that President Cyril Ramaphosa has just signed off and which came into effect today.
Crime intelligence did submit an early warning, but which does not relate or point out exactly the unrest modus operandi.
After a dismal performance yesterday in front of the Human Rights Commission, we speak to a police union that's now calling for the sacking of the National Police Commissioner.
I can see no reason why it can be said that it is in the interest of the work of the Commission to grant the applicant leave to cross-examine any of these witnesses.
How former intelligence boss Arthur Fraser got to lose his bid to cross-examine witnesses who implicated him at the state capture inquiry. Those stories and more in tonight's episode of The Watchdog, which starts now. In news just in, about an hour ago, the National Institute of Communicable Diseases, the NICD, released the latest COVID-19 statistics. We now have 8,581 cases reported in South Africa over the past 24 hours. Now, yesterday, this time, we had 4,373 cases, which means the numbers have more than doubled over the past 24 hours. Our first guest on this issue is Dr. Fundile Nyati, a medical practitioner, but who's also been very active in this area. Dr. Nyati, good evening. Thanks very much for your time. I don't know whether you are as alarmed as we were as the team when we got these numbers about an hour ago or so.
Well, as somebody who's been tracking these numbers over the last, few days since the middle of November, certainly very, very, very alarmed. Because remember, on the 15th of November, we only had 136 new cases. Now, just about 2 weeks later, we now have 8,581 cases, a doubling from yesterday's caseload. It is a serious challenge. And obviously the fact that more than 80% of those numbers are coming from the province of Gauteng, where we are both residing, is even more worrying. But it's something that was predicted by the epidemiologists and the other people who are able to project these numbers. But it has come a little earlier than, what they had said. They had said middle of December, peaking in January. But actually, we are now beginning December, and it's already, seemingly, going the way it is.
And I know we are in the realm of speculation here because, the people who have the tools and the instruments to actually, give us more accurate information are still busy with that task. But one wonders just how much of this may have a lot to do with the fact that, the festive season has effectively begun. And given, the past couple of years and, how people, feel that COVID-19 has deprived them of, the fun and just the opportunity to just relax a bit, but also, de-stress, from the from what they've gone through. Everyone, has basically had a friend or a relative or a neighbor who has, died from COVID-19. One wonders whether a combination of at least some of the couple of things I've mentioned may well be contributing to this factor. People saying, what the heck, let's just have fun for once. It's at the first opportunity we've had. And of course, that opportunity coming on the back of us having seen a significant decline in numbers, on the back also, of course, of a fairly significant number of people who have been vaccinated.
Well, it's a combination of factors, Vuyo. One, yes, there is the issue of COVID fatigue. We've gone through 3 waves now, and people still have fresh memory of the fact that the past December, actually, they could not really enjoy, the way they wanted to. And people were crossing fingers that this year things are different. But what people have forgotten, though, is that, whether there are lockdowns or no lockdowns, the numbers, it's all in our hands, how we behave. So as South Africans, when they saw that the numbers after the third wave have gone almost to, less than 200 per day, they thought, well, COVID is gone. But COVID is not gone. And so they stopped the non-pharmaceutical measures. And in the same breath, they also decided, what's the point of vaccinating? And so now we are being caught napping because we have not done what we're supposed to do to prevent. But on the other hand, the only tool that we have to prevent, severe infections and deaths, which is vaccination, the numbers have gone down. But I think there is also some good news, though. Since this Omicron, announcement last week, the numbers of people going for the first time to vaccinate has actually gone up again. But it's still very far from the 300,000, that is the target. I think on Monday we had something like about 150, 160, thousand people, but it was still an improvement. Because it was people are now starting to be worried about the 4th wave and the new variant. But we really should be listening to the president. We should be doing everything in our power to actually make sure that this 4th wave does not become higher than the 3rd wave. And when I listened to the CEO or MD of Netcare yesterday, Dr. Friedland, what they are seeing, at the Med Cross and the hospitals, they are seeing numbers that are very high of adolescents and teenagers. A number of schools are reporting infections amongst the school-going kids. So there's something that is emerging about this, variant in terms of the younger people. Obviously still too early to be definitive about it. More information is still being sought, through research and everything. But the point I'm trying to make is that South Africans have become lax and we are being caught napping. And if we do not change how we do things, we may have another festive season where we have to stay in our houses with extreme lockdown.
That's where we're going to leave it. Dr. Nyati, thanks very much for your time and insights this evening. He's a medical expert, but also he's been active driving those very important messages home all the time and every time he gets an opportunity. Just in case you have missed it, from the numbers that were released about an hour ago or so, we now have 8,581 cases of COVID-19 in South Africa, up from 4,373 cases that were reported yesterday. And as Dr. Nyati has been saying, it's been alarming. We all need to be a lot more vigilant than we perhaps have been over the past couple of weeks, especially.
End inequalities, end AIDS, end pandemics. World AIDS Day.
We may have made significant strides in the fight against HIV and AIDS. The battle, however, is far from over. Scores of people continue to die of HIV and AIDS complications. That's the South African government's assessment of the situation. Deputy President David Mabuza today addressed the official commemorative rally for International AIDS Day.
As we aim to strengthen our antiretroviral treatment rollout, as well as finding the missing HIV and TB cases, we need equally to upscale our prevention efforts across all levels of society, as this will be a deciding factor in our ability to curb the spread of this epidemic. As a country, we have made significant strides and gains in the fight against HIV and AIDS epidemic, despite the many and complex challenges that we continue to face in the midst of COVID-19 pandemic.
Deputy President David Mabuza there. He is, of course, also the chairperson of the South African National AIDS Council, speaking there at that official rally which was held in Limpopo. Now, as we have been doing over the past couple of weeks, we're bringing you people, South Africans, who have committed their lives, who dedicate their resources and time to helping, assisting and supporting people living with HIV. And our guest this evening is Nonjajambo Makapela, who is a program officer for an organization called Sister Love. Nonjajambo, good evening. Thanks very much for your time. The Deputy President saying there that we need to upscale our efforts. Just from where you sit, where did we or could we have dropped the ball?
Okay. Good evening for you and to the listeners and the viewers. In the context of HIV, sitting here as a woman is living with HIV, I see a challenge when it comes to the access to services for people living with HIV. And because the focus now is on COVID-19, how we can prevent COVID, forgetting that we are still sexual beings engaged in sexual intercourse. So I think for me, there should be integration in terms of these programs. We cannot neglect one challenge and focus on a specific challenge, because the rate of HIV infection every day, and then we see, and especially women, young women getting infected. But at the same time, if we want to reduce or decrease the rate of HIV infection, we need to emphasize on HIV prevention. How do we do that if ever the space is not conducive even for the women to go and access services, including HIV prevention?
In fact, over the past few months, we've had the Treatment Action Campaign here on the program several times on the back of reports that they had issued, where they found that, people are complaining that they go to hospitals and clinics and they don't get their medicine, they don't get proper service. those backward attitudes continue to prevail. Yet, I mean, in terms of the Stats SA numbers, we are sitting with 8.2 million people who are living with HIV.
Mm-hmm. Okay, as a Sister Love organization, our main goal or the role that we are playing in the community is to raise awareness, doing education on HIV prevention, but also to make sure people living with HIV, they do get access to the clinics. The treatment action campaign is very correct in terms of these experiences in our communities. You go to a clinic and then you want to get services, but you will be told that, your medication is not there. But at the same time, people who are living with HIV, I don't think they are a priority. Also, in terms of the work you are doing as the media houses, because we see less conversations that are talking on HIV prevention. I'm not sure if we wait for the World AIDS Day so that we can emphasize the importance of preventing the HIV. As I indicated earlier, we are sexual beings, be it there is COVID or not, we are still engaging to sexual intercourse. And the reality is that there is advance in terms of HIV prevention measures, and especially for adolescent girls and young women. But when it comes to the uptake, the priority is with COVID. There is a role that we need to do as stakeholders, as organizations, but the government should be at the lead. The media should engage us more often so that our challenges can be raised through as spaces, so that the government can get the pressure and understand that we cannot separate the infection here, COVID, from HIV, and also rate of unemployment and gender-based violence.
Now, it's interesting that not only are we engaging in sexual activity, but according to one organization that issued a statement, I think it was last week, if I'm not mistaken, which was calling for people to practice safe sex, because there seems to be higher numbers of people who no longer do that.
Okay. We are definitely, also as Sister Love International South Africa, we are encouraging, we are giving options to people to use protection. But how do we expect women, if the women preventative method that we have is only a female condom? Remember, we are women in our diversity. And then if prevention doesn't include women in their diversity, and also seeing irrealities of gender-based violence or violence against women and girls. We are in relationships with older people. Sometimes it's difficult even to introduce a condom. In other words, we are in relationships that dictate in terms of when to use a condom or not. So be it COVID is there or not, the issue also here, gender-based violence, need to be addressed, because there are these power imbalances in these relationships or sexual relationships that we are in. It's not that we don't want to use protection, but if we are depending on male condom, or we don't see a lot of visibility and education on female condom, how are we going to do this? If we are talking about women who are on same-sex relationship, what are the prevention measures that government is providing for them to make sure that they are also protected? So these are some of the issues. We all want to use protection, but if there is no availability based on challenges that are in our communities, be it is COVID or it's the stigma attached to that prevention that we are trying to access. So it means all of us as communities, we need to stand up and also raise conversations that create an environment to be safe around these issues.
In fact, the Department of Women the other day, the DG raising the very same issue, the issue of power relations, and economic empowerment. The fact that many people, women in particular, depend on a lot of men, for support. And as you have just said, they can't even begin to negotiate these things. But speaking of stereotypes, speaking of public attitudes, I liked a tweet I saw earlier from the WHO, a tweet that they posted around stereotypes, saying you will not get HIV from standing by your friend, drinking tea together, hugging, shaking hands, showing that you care. I guess all in an effort to really, mobilize the society the world over, that it is important to actually give support, and to do away with the stereotypes, that are really not helpful.
Mm-hmm. Okay, I really agree with that. And Vuyo, one of the things that listeners need to remember is that as a country, we are advanced in terms of prevention. We are talking about treatment as prevention. No, you are taking antiretrovirals every day and you are adhering to your medication. It means there are minimal chances that you can pass the HIV infection to your partner should it happen that you don't use a protection. So people must know that even when you are engaging to a sexual intercourse, it happens that the condom breaks or you don't use a prevention tool. If you are in a relationship with an HIV positive person who is adhering on treatment, you are at less risk in terms of contracting HIV. That is why we are always saying we don't want a stigma to win. Let's live in a society whereby people living with HIV are not discriminated. They're not being stigmatized because life is there after living with HIV. And we see, and also pre-exposure prophylaxis. If you are in a discordant partner relationship, your partner is negative and you are positive, your partner can opt to take a treatment to prevent HIV. So it's not about only hugging and everything. You can still be in a relationship with a person who's living with HIV, you're not living with HIV, and you are safe. So there are many options. And maybe one of the messages that I want to emphasize is that it is important for people to know that they are not discriminating, or they are not only supporting people living with HIV because a person is living with HIV. Support people because they are people. And then also they must not expect all the time when a person is living with HIV to disclose her or his or HIV status, because if the environment is not conducive for you to disclose, definitely you are not going to disclose. But it's all of us that needs to take responsibility in terms of prevention. So we shouldn't be given a responsibility to protect the world. Each and every person has a duty and a responsibility to protect himself or herself.
Just a final thought. I was at the head of the WHO, Dr. Tedros, yesterday reminded us that more than 40 years into the global AIDS epidemic, we still have no vaccine and no cure for the disease. Yet 2 years into the COVID-19 pandemic, we have not one, but many vaccines and many other effective tools. Just your thoughts?
Whoa, and when I recall, when I started knowing about my HIV positive status, I was adolescenting, I was an adolescent girl. And then now I'm at my 40. I used to think that by now we will have the vaccine just for the people who are living, who are HIV negative. And I am still surprised. I'm not a scientist, but I still feel that scientists, if they wanted to have, different options in terms of vaccine, we will have it. It's been long waiting. And then now what we are saying, it's not for us, it's for the younger generation. It is quite important to have different options. And it's quite surprising, to be quite honest, that for the past few months or few years, we've been talking about COVID-19, and then we are currently having the vaccine. But when it comes to HIV, we are more than 40 years, and then we are still waiting. But hopefully scientists are doing something, because I hear that there is a lot of work that they are doing in terms of vaccine development. I don't know.
That's where we're going to leave it for this evening. Nonjajama Makapela, thanks very much for your time. She is a program officer for an organization called Sister Love, which assists people across provinces, especially adolescent girls and young women, as well as their male counterparts. Their primary goal, they say, is to educate, prepare, advocate and support communities, especially women and girls and young men, for the implementation of high-impact prevention programs. We do hope that from the people we've been in conversation with over the past couple of weeks, and we'll continue to have those conversations, that you're gaining a lot, but also you are able to support these South Africans who are doing so much with their time, but with little resources to try and help people living with HIV and AIDS. Now, Gauteng Premier David Makhura has acknowledged the reversals of the gains made towards ending HIV and AIDS due to COVID-19. Makhura also acknowledged that a lot of people couldn't get ARV treatments during the various lockdowns. Something, of course, organizations like the TAC, as I was saying earlier, have actually been raising throughout this COVID-19 pandemic period. Makhura was speaking during the Gauteng World AIDS Day commemoration event in Duduza in Ekurhuleni. This year's commemoration is held under the theme Working Together to End Inequalities, AIDS, TB and COVID-19.
Last year, government resources were reprioritized to deal with the COVID-19 pandemic. This meant that other illnesses such as HIV and tuberculosis had to take a back seat. Initiatives to end the HIV/AIDS epidemic were interrupted, causing many to default on crucial medicines. But Gauteng Premier David Makhura says that is now a thing of the past.
We have drawn important lessons. When you fight one pandemic, don't shift your resources and your focus away from the other. You know, we also have other pandemics, gender-based violence, teenage pregnancy, all those are very, very serious social ills. They are social pathologies. They need to be tackled simultaneously.
Makhura acknowledged that progress towards reaching the UNAIDS 90-90-90 treatment target was significantly reversed. Before the lockdown, 66% of those living with HIV were on ARV treatment, while 88% of them had a significantly reduced viral load. People living with HIV say the prevalence of other societal injustices has made life even harder.
Our voice and silence on the gender-based violence, yet we are more victimized on the gender-based violence due to our disability. The people will rape me as a person who says, or for me, because I'm using the wheelchair, I can go and report the case to the police and do whatever. But the person who's deaf cannot be able to report the case on the police because there's no one who understands the sign language.
The Gauteng government has urged South Africans to vaccinate. It's noted an uptick in the number of vaccinations following the discovery of a new variant. Mbalendle Ntetwa, SABC News, Johannesburg.
Well, time to take a quick break. The Watchdog will be back in a moment. Well, imagine writing a WhatsApp message and then ending up in jail. Well, President Cyril Ramaphosa today has signed a new law which came into effect today, which may mean that certain messages that you and I write may actually be prosecutable by law. Well, let's bring in an expert now who's going to help us understand what these laws are about and what they may mean for you and I. Mamela Luthuli is the Chief Executive Officer of Take Note IT. Mamela, good evening. Thanks very much for your time. People have spoken about this law before while it was being contemplated, and then was a bill, and that passed. It went through Parliament and so on. Just in a nutshell, what the point of it all is, what it seeks to do or achieve.
Good evening, Vio. Thank you so much. So in a nutshell, it says be careful of the information that you send. So this law seeks to protect and to prevent people from just sending insightful messages to other people. You know, so in a nutshell, this is the law. It's the law in South Africa that prevents you from sending insightful messages that are threatening property, to damage, where you threaten people. even to send unlawfully contained and intimate messages. So now this is the law, is prosecutable. You can be sentenced up to 15 years.
Wow. Now, let's imagine a hypothetical situation, which was what happened in KwaZulu-Natal and Gauteng during the looting and the violence we saw, which is currently a subject of this Human Rights Commission of South Africa hearings that are taking place in KwaZulu-Natal. How would this law have helped in tracking down the culprits that are allegedly behind what actually happened there? In other words, how would it have been able to deal with those people in a way that police and everyone else involved or any of the state law enforcement agencies weren't able to do a couple of months ago?
No, thank you so much for now the biggest opportunity now, this is empowering the SA police, because now this is the Cybercrime Act is giving them the right to demand the information, and also they are allowed now to even demand to have your computer or access to your phone if you are deemed to have incited violence via the social media. So now it would have been much easier to track down the perpetrators and prosecute them, because now they've got legs to stand on, which is this Cybercrime Act.
Now, I mean, you've spoken directly to the two instances that are very specific and direct, that if you incite damage to property or violence, if you threaten people with damage to property or violence. But there's a third one that the layperson in me doesn't quite understand, and that is unlawfully contain an intimate image. What is meant by that?
So that one means that if you've got my picture, my nude picture, without my consent, I can sue you if you can send it to someone else. If you maliciously send the pictures of my breast or my private parts, even if my face is not showing, my name is there, I can lay a charge against you. So in a nutshell, that's what this law says. Is giving those powers to the citizens, and also empowering the police to investigate.
Okay, let me be hypothetical again. Say one party asks the other for nudes.
Yes.
And the party that receives sends the nudes to someone else to boast about being sent, or whatever the case or their intention may be. What does the law say now around that?
Crime. It's the crime as long as you share my private images without my consent. Now I can lay a charge against you and you can be prosecuted.
It's that simple.
It's that simple. And so people need to be careful on how now you can't just share information with the intention of being malicious or of embarrassing someone else. It's by law, without my consent, it's the crime.
Now, are there, well, I would imagine, as with any other law, if someone then, say, argues grounds for that and gets to, say, demonstrate that there was no evil intent or it wasn't meant to harm, but let's say they just couldn't contain their joy and happiness, at what the other party may have sent them. And I'm asking this, and I'm probably even a little flippant about it, but often this is how people understand things, only to find out later that actually the law was not on their side. Whatever they may have imagined or assumed is simply, has no standing in law.
No, the law, Vuyo, is explicit in saying that if you share the nude pictures of an individual without that person's consent, that person can lay a charge and you can be prosecuted. It's simple as that. And it goes even further to say that even if the face of the person is not showing, but the name of the person is there, and this person is confirming that these are my private parts, you can be prosecuted for that. So people need to be careful of what information they share on social media and on their WhatsApp messages.
Mamela, thanks very much. We're going to leave it there for this evening. She is the Chief Executive Officer of Take Note ID. We're talking, of course, about the Cybercrimes Act, which comes into effect today after President Cyril Ramaphosa signed it into law. So do beware if you are planning what some of the people were told planned in KwaZulu-Natal and in Gauteng, which resulted in that looting and plundering and violence that we saw a few months ago. This law is going to make it, hopefully, easier for the police and other state law enforcement agencies to prosecute you. The same goes for distributing nudes and other similar images without the consent of the people or the person involved. So life is going to be a lot more difficult for people who may just fall into those two categories. We're going to take another quick break. The Watchdog continues right after this. State Capture Commission Chairperson Justice Raymond Zondo has dismissed former State Security Agency Director General Arthur Fraser's application to cross-examine witnesses that implicated him in state capture. In passing judgment, Zondo questioned why Fraser behaved as though he had struggled to get documents he needed for his cross-examination from the agency, even after Acting Director General Loyiso Jafta agreed to assist him. Zondo says Fraser had not complied with the Commission's rules required to cross-examine SSA officials Mo Sheikh, Gibson Jenje, Ambassador Mzuvukile Maqetuka, and high-level panel chair Sydney Mufamadi. Now, in a second, we're going to bring you what Deputy Chief Justice Zondo had to say in his ruling. But first, we want you to take a listen to what Arthur Fraser said on this program a couple of months ago when we asked him about this matter.
I have requested to appear before the Commission.
But wasn't that important? Because, it's not just the Bosasa issue. Several other people have actually leveled allegations against you. The Mufamadi panel appeared before, Mufamadi himself appeared before the Commission and said things that were actually very, made very serious, serious allegations were actually made against you.
Very, very serious allegations.
Did you not feel there was a need to actually clear your name?
The most serious allegation was made against me at the Commission. I was accused of treason. So surely, of all the witnesses that were called, surely Arthur Fraser should have been afforded the right to provide his side of the story. And Arthur Fraser, I can tell you, after Jeff Maqetuka appeared before the Commission on the 10th of July 2020, I had sat for 4 days at the Commission's doors requesting an audience with the chair and insisting that I be afforded the opportunity to clear my name. I am still waiting for a response from the Commission.
Mind you, some of these allegations, it wasn't the first time that some of these allegations were actually made. They had been made to the panel.
Correct.
Did you challenge? Arthur Fraser there, of course, raising the grievances that he had. But of course, today, the State Capture Commission's chairperson, Justice Raymond Zondo, gave his reasons for dismissing the former State Security Agency Director General's application.
The rules require that an applicant for leave to cross-examine a witness is required to furnish the commission with his full version or account of the events that he is implicated in. In this case, one, the applicant has not complied with the rule in relation to identifying in the affidavits of the witnesses exactly the paragraphs and parts of paragraphs that he disputes and which implicate him and what his version is in regard to that. But two, he has, on his own admission, said that his version is incomplete without the documents that he sought to obtain from the State Security Agency. The Commission adjourned his application on the 14th of April in order to give him and the State Security Agency an opportunity to discuss and reach agreement on the documents that could be made available to him, because quite clearly the State Security Agency was prepared to give him documents if they were relevant to the scope of the commission or relevant to the allegations that had been made against him in the commission, and if it could do so without being in breach of the law. It is quite clear that they agreed as to what should happen, and that included compliance with Chapter 24 of the regulations promulgated under the Intelligence Services Act of 2002. The State Security Agency says he has not complied with that. In order to get the documents that he contends he is entitled to get, he has not explained why he has not done so in circumstances where he told this commission on affidavit that those documents that he sought were very important in order for him to complete his statement and to give this commission a complete picture. In those circumstances, I can see no reason why it can be said that it is in the interest of the work of the commission to grant the applicant leave to cross-examine any of these witnesses in the circumstances that I have set out in relation to non-compliance with the rules of the commission and in relation to there being no explanation as to why, having said that his statement would not be complete without the documents that he asked for from the State Security Agency, and the commission having given him time to ensure that he secured such documents, and the State Security Agents having undertaken to give him such documents, why he has not pursued that and why he is no longer seeking to place those before the commission so that his statement before the commission is complete. In all of these circumstances, I've concluded that the applicant's application stands to be dismissed, and it is so dismissed.
The State Capture Inquiry Chairperson, Justice Zondo, giving his reasons for declining to give former intelligence boss Arthur Fraser permission to cross-examine witnesses who had implicated him at the state capture inquiry. To this now, after his dismal performance yesterday in front of the Human Rights Commission, National Police Commissioner Ketla Sitole, or some of the police that are under his charge, are now asking for him to be sacked. One such union is the Independent Police Union of South Africa, and we joined on the line by Bethel Nguna, who is their spokesperson. Mr. Nguna, good evening. Thanks very much for your time. That was quick. I mean, your response was pretty quick. Did you not prejudge the matter, given that a lot of facts are still not on the table? On what basis are you now calling for the sacking of the National Police Commissioner?
Very good evening, Vuyo, and good evening to the viewers. Vuyo, as IPUSA, the Independent Policing Union of South Africa, when the July unrest happened, already the bickering that was happening, whereby the minister and the commissioner, and also even the intelligence service, where they were throwing words at each other about a report that was not received, and while the other saying they've sent a report. Already, we have already suspected that there is a dereliction of duty by the national commissioner, because there was no way that such an incident that has happened, even a layman would have noticed that the arrest of the former president, Jacob Zuma, would have such a repercussion. So the fact that there was not even an intelligence report leading into the July 8th unrest has already indicated to us as IPUSA that there is a breach of constitutional duties again by the police commissioner. So it was not a matter of responding quickly, because even before his dismal performance at the Human Rights Commission, we've been calling upon the state president to expedite the process of appointing a board of inquiry into his fitness to hold office.
Now, a point taken. I mean, you had formed an opinion of him from how events unfolded. Now, other people found it or weren't happy with the fact that, one, the National Police Commissioner was nowhere to be found. Other people took issue with the fact that he seems to be underqualified for such a senior position as a National Police Commissioner, given that some of you have to, have Matric +3 to be able to function in certain positions, or to be able to even apply, let alone be considered for certain positions. Just your view on those two, the fact that he was nowhere to be found, and the fact that he seems to be under or unqualified.
It is very worrying, Vuyo, to learn that he was nowhere to be found. And also his responses to say the minister was looking for him at wrong places. For us, it's a very disturbing response, because we were facing, it was a national crisis. His responses are very disturbing. So, for him to try to want to justify his nowhere to be found stance, together with him not even visiting the areas that were affected by this riot, it does not build a public confidence in the South African police services led by the current national commissioner. The issue of him being underqualified, we just don't understand how was he put there in the first place. but we'll be looking more at his dismal performances that are leading us into saying his fitness to hold office must be established.
Bethel Nguna, let's thank you for your time this evening. Pity we couldn't get you on a stable video line there. Bethel Nguna, he's from the Independent Police Union of South Africa. They are calling for the sacking of the National Police Commissioner on the back of the dismal performance that he showed yesterday in front of the Human Rights Commission, where he was supposed to account for what happened in Gauteng and in KwaZulu-Natal during those riots and looting. And that's the show for this evening. Do join us again tomorrow night, same time, 8 p.m. sharp. Have a good night.